Good afternoon, everybody. I'm Jody Hanson. I'm the Director of Public Affairs and Communication for Johnson County Government. With me today is Dr. Sami Ariola, who is the Director of Johnson County Department of Health and Environment. And we also have Robin as our ASL interpreter. Thanks to both of you for being here today. Dr. Ariola, I know you just came from a meeting with our healthcare system partners. Wonder if you could give us an update about what you talked about there.
Thank you, Jody, and good afternoon, everyone. So yes, I just left a meeting, a weekly meeting with health systems, and as always, trying to plan for the coming weeks, but also to provide updates. And prior to that meeting, we had spoken with the state. The good news is we are going to be getting more doses of vaccine next week. We will be getting more than we have received in the past. We will be getting 18,720 doses of Pfizer. And if you think about that, that's more than double what we were getting for 4 weeks ago. And so that's good. In addition to that, we're getting 1,000 doses of Moderna vaccine. Those 1,000 doses, though, for a specific purpose. They are meant to expand where you're able to get your vaccines from. Those are meant to go to private providers, your private doctors that are across the county, so that they can also give vaccines out. So we do have a few logistical things to work out there, but that's good news. Again, combined total, it's over 19,000 doses of vaccine coming in. So that just, again, we still have a lot of second doses that we have to give out between today and next week also. And so we are going to continue to work with our providers to be able to give these vaccines out as quickly as we can. But we're happy that more vaccines are coming into the county.
That is great news. It's nice to hear those kind of numbers,
yeah.
and know what that means for our community. I know today was the second day at the new clinic, and you also had a clinic at Oakland. So maybe you can just let us know how did the clinics go today?
Yes, the clinics went pretty well. The clinic at Lenexa, our new location, we planned to give out about 750 doses today to vaccinate about 750 people. We did just under 700. Those are the people that showed up. Everybody that showed up was vaccinated. At Oakland, we vaccinated almost 1,300 persons there. So that's a lot of vaccination in a day. It's people that are due their second doses are going there at the time that they're due and the date that they're due. And that's tomorrow is the same thing. There's going to be a clinic at Oakland for those that are due their second doses. Again, target is tomorrow. I think it's slightly fewer than that. I think about 500, 600 people are due their second doses tomorrow at Oakland. But at Lenexa, the new location, we are ramping up the number of appointments. That's up to 1,000 tomorrow. Again, easing our way into the new location. And things are progressing very well. I debriefed with staff, as I always do, after the meeting, and asked the question, and there were no issues today at the location. So we're pretty happy that things are working very well.
Are you getting any feedback yet from people who have come to get their vaccines at the new clinic as far as how it's going for them?
Oh yes, we are getting emails, we are getting phone calls, we're getting cards from people who are appreciative and saying things are working very well, and so that's good. Now we're hearing from people who wants to get vaccinated, and while we don't have all the appointments needed, that's good too, because we do like that the interest level remains very high in our county. By tomorrow, we will open up appointments for clinics next week, again, to get more people vaccinated. And hopefully I'm able to share even more information. There are a few other things that we're working on to get more vaccine into the county, but to get more people vaccinated. So should have some pretty good news coming in the next couple of days to get to give more opportunity for people to get vaccinated.
That's great to hear. We got a question from somebody that has filled out our interest form and hasn't heard back. Didn't say what phase they're in, but just in general, is there any advice for someone like that that's filled out the form and hasn't heard anything yet?
Yeah, excellent question. So I'm going to take some time to explain a little bit more in details as to where we are. Now, last week, we did a poll for people who have completed the form for phase 2 that we have now reached out to, for 65 plus. So we did identify a few thousand people, about 3,000 people that said they still want the vaccine. They're on the list, but they've not been able to get vaccinated. Well, so we opened up the appointments. And then also in addition to that, we pulled another 2,000 from the list of people that have completed the online survey for phase 1 and phase 2. And those were the people that we were targeting with our appointment, and we sent those appointments to them. Those appointments were filled in a matter of minutes, and they were filled because the appointment is there, it's open, and people want the vaccine. So that ability to control who registers, we're working on that also. Again, very happy that people want the vaccine, but we appreciate people following our instructions and rules. It disrupts our plans when we're not able to do that. Again, if you are in phase 1, phase 2, expect us to reach out to you very soon in a way that will guarantee the appointment that we have open for you that cannot be taken up by others. We're working on that. Hopefully that comes very soon. If you are in phase 3 or 4 and you have just recently registered, just be slightly patient. Again, there's just so many appointments that we have. Our health systems also are vaccinating. Our pharmacists are vaccinating. We're looking to pull in more pharmacists to be able to vaccinate in this group. But if you are on our list, we're going to reach out to you. We're trying to fix somewhere so that our plans can be more effective in reaching out to targeted population in that group. Right now, ensuring that who we are targeting is who is getting the appointment, there's a little bit of challenges to that. So you don't have to do anything else if you've completed that. All I'm asking is a little bit of patience, and we'll reach out to you and ensure that you'll be able to book appointments.
That sounds good. Somebody's asking, which vaccine are we currently using? Still the 2-dose vaccine. So I know you just talked about next week's allocation, but I guess in general, can you talk about which vaccines overall we are mostly using?
Yes, we're mostly using Pfizer vaccine. We're getting more Pfizer vaccine than any of the other types. We've only gotten one allocation of Johnson & Johnson, and that was about 2 weeks ago. And those were used to target a population that we feel it's more advantageous, that would be a little bit more logistically difficult for them to come for the second dose. We did not receive Moderna vaccine for several weeks, but we received some last week and we received some this week. So if you get to our clinic, we still have some people that are due their second Moderna vaccine and we're giving to them. But our clinics right now, you could get, you are more likely to get Pfizer vaccine. You could get Moderna. Right now, we don't have Johnson & Johnson unless we get new shipments coming.
Okay, and we have a couple questions about you had just talked about the amount of doses that we're getting next week. So maybe for someone that maybe just joined at the end, if you could just kind of again say what we've been told that we're getting next week, and someone wanted to know, is that only for the county clinics or vaccination clinics, or is that for everybody next week?
Right. So every number that I provide here is the total doses that are coming for to the county, for not just for our clinics, but for our health systems and all of our partners in this. Now, the only thing that it does not include are the direct shipments to the pharmacies through the federal retail pharmacy program. But the doses that I'm talking about is for all of our providers, and some of them are shipped directly to our health systems. Actually, most of them are shipped directly to the health systems, and some to us. So that's the entire dose coming into the county. But it really doesn't matter, because we are all collectively working to vaccinate in that group, to vaccinate our residents. So whether you are getting it at the county clinics or you're getting it through one of our partners' health system, is the same. That's the pool that's coming to all of us in the county.
And so you are informed of the total number, not just the number that is going to be given in your clinics, and that's the number you share.
Yes, we are informed of the total numbers. Thus far, we also do have, in collaboration with our health systems, do make decisions on how many is going there, depending on what they are doing. For example, if you have a health system that's going to give 3,000, 4,000 second dose in a week, they may not be able to do a lot of first doses. So we make those decisions in collaboration with our health system. But the doses that are coming, we are informed, and that's the total amount that's coming into the county.
Okay. And this is sort of a related question, but we have another question. So with doctors' offices now being able to receive vaccine, is that going to slow down the amount that's coming to Johnson County Department of Health and Environment?
It shouldn't. So these are designated. This week, the 18,720 doses of Pfizer are coming into the county. The additional 1,000 doses of Moderna are meant to go to the doctor's offices. So that, again, the way to look at this is, that means this week, we have 19,720 doses of vaccines coming into the county. Again, I do want to emphasize that reliance on the county clinic is not enough. Even if we are, right now we are running 2 clinics simultaneously. Even if we are doing 3, it's not going to be enough. For a county with a population our size, 2 or 3 will not be as efficient as 20, 30 locations. That's the thing to keep in mind. So it's 19,720 doses coming into the county. When they go to the doctor's clinic, some of our residents will get vaccinated there.
Just to give some perspective, I'm looking at the chart that we've started keeping of our weekly doses received. In the very first week, we got 1,200. So we've come a long way. Someone has a question. Is there any way the Johnson County government, is it feasible for us to directly work with the federal government to obtain a greater allocation specifically for our county?
I am not aware of how to do that. But again, I do want to emphasize the collaboration with the state on this. The state also would like more allocations, and you talked about the first dose we got was 1,200. After that, there was a stretch where we were literally going to our partners to beg for vaccines. Then after that, that increased to 3,900 doses. Then for several weeks, we were getting 6,700 doses, 725. And then once the recalculation changed from 5 doses per vial to 6, that became 8,100. And that's what we got for a long stretch. So 19,000 doses coming in is more than 2 times, about 2.5 times the size of what we were getting about 4 weeks ago, the amount of what we were getting about 4 weeks ago. So that's huge. And so I am happy about that. And we expect even more vaccines to start coming into the county. And so right now, our job is to put the machineries in place to ensure that these are distributed as quickly as we receive them.
We have another question. As we move into new phases, will the health systems still choose people from their own portals or their own patients, I would say, first?
No, I believe that virtually all of the health systems are vaccinating broadly right now. They are vaccinating broadly. Go to their website or go to our website. We have the links to all of them. jocogov.org/coronavirus, and there's a link beautifully put together by Jody and her team. And you can click and go to each of those health systems and book appointments there. No, they have broadened people that they are vaccinating. And like I said, pharmacists are vaccinating, and we're trying to pull in even more of our pharmacists. And now that doctors' offices are going to have vaccine available, really, these are really good things. There are more and more providers that are being pulled in, and more ways to get the shots into as many arms as possible as quickly as we can.
Well, I think we covered a lot today. Is there anything that you would like to summarize with, or any closing remarks before we wrap up for today?
Yes, Jody, it's pretty good news. To me, 19,000 doses of vaccine coming in takes me back to the 1,200, takes me back to several weeks of less than 7,000 doses. And so the way that I look at it is precisely that. We have been asking for more vaccine. They're here, and that translates to very good news for our residents. We want to get people vaccinated, and if vaccines are available, that is the first big step. Now it's let's put processes in place and get people vaccinated as quickly as we can. So patients, right now, we know that in next between now and next week, between us and our partners, it is possible to get close to 20,000 persons vaccinated. Those are fewer people that we have in our big list, in our big denominator, and that increases the chances the following weeks of you getting an appointment to get vaccinated.
Great. Well, thank you so much for sharing some good news with us. That number of vaccines coming in is exciting, and we hope to see it grow from there and continue. So thank you so much, Dr. Arriola, for being here with us and sharing some information and answering some questions. Thank you so much, Robin, for being our ASL interpreter. And thanks to those of you who are watching on Facebook. We appreciate your engagement on this topic, and I hope you have a great rest of your day. Thanks very much.